Hello guys, welcome to my YouTube channel Let's Join Pharmacy. Today in this video, let's discuss about Pantoprazole. What is this Pantoprazole? Some of the brand names are related to the Pantoprazole, uses of this drug, dose, contraindications, half-life, that is a pharmacokinetic here we will discuss, and the last side effects, and also one more additional compound, that is how to prevent this hyperacidity. I will tell you later on here, so be until last in this video. Yes, first let's discuss what usually this pantoprazole it is. See, pantoprazole, you know that it is the tablet or intravenous route or in a solution form. Mainly it is given to control the hyperacidity, or to inhibit the HCl, excess HCl production. Okay, usually OD is enough to control mild acidic problem, means once a day. Okay, or you can give twice a day, morning one and night one. I will tell you in a dose form how to take that one, and don't take more than 1 month this medicine. As pantoprazole, it is a type of medicine called a proton pump inhibitor. Okay, it is a proton pump inhibitor. It will inhibit the HCl and it will stop the production of HCl in the stomach. This is the main mechanism of action of the pantoprazole. Next, some of the brand names are there. You go through these brand names. See here, like Pan 40, it is one brand name. MRP also I have mentioned here. 155 rupees 15 tablets. Pentakind 70 rupees 15 tablets. And Pentop, then Panam 40 mg. At last, Top 40 mg. 26 rupees 10 tablets. It is very cheap in the market. You can consume this one. Okay, if you want. And this medicine you have to take under the prescription of the doctor only. Okay, don't purchase any medicine by yourself. Don't go for self medication, it leads to severe side effects. Next, some of the uses, see, heartburn. If a patient is suffering from the heartburn, burning sensation in the stomach, then we are giving. Then acid reflux, that is the GERD. See, this one is acid reflux. Here what happens, HCl is there, no? HCl and some of the food particles, they will just come out from the esophagus. That is the acid reflux. And Zollinger-Ellison syndrome. What is this Zollinger-Ellison syndrome? Zollinger-Ellison syndrome, nothing but here what happens, ulcers in the stomach, or means or acid reflux. Okay, this is a combination of the some of the symptoms. Heartburn also here occurs. And stomach ulcer, it is a major problem. Stomach ulcer, basically ulcers will occur in the stomach and the duodenum. Okay, these are the wound type pattern inside the foldings of the stomach. Okay, that is leans to the mucosa. There is some wound type session found in the stomach that leads to severe problems. This is also due to the excess secretion of the acid, that is HCl. So to prevent this acid, to prevent the ulcers, we are giving this pantoprazole. Next, doses. See here, dose, if you discuss about the dose, means BD, means 2 times a day. For better action, take before food. This medicine is given before food. And for children, 40 mg for 40 kg child. If a child is 40 kg, then only we can give this drug once a day. Maximum dose 40 mg to 220 mg daily we can give. This is available in different forms, in tablet form, intravenous form. Then it is also available in the suspension form, pantoprazole. It is available. Next, contraindications for not for, means these medications, these medicines is not for those who are sensitive to pantoprazole. Okay, some patient, those who are sensitive to pantoprazole, they can go for the next proton inhibitors, proton channel inhibitors, like some of the omeprazole is there, lansoprazole is there, rabeprazole. They can provide that one. But here, those who are sensitive to pantoprazole, they cannot take this medicine. And kidney disease, osteoporosis, here what happens mainly, why osteoporosis patients cannot take this, means here initially what it will do, this pantoprazole, due to long use, it will deplex the formation of the bone, or there will be formation of cracks on the bone palate. Then lactation mother cannot take this, and pregnancy, in pregnancy also it is totally unsafe. unsafe. We cannot take this, means it shows some of the fetal defect. Better doctors will prescribe here omeprazole tablet in spite of this pantaprazole. Pharmacokinetic half life of 1 to 2 hours, yes, 1 to 2 hours, but if we modify that tablet in some of the modified release or sustained release, the half life can be increased of this pantaprazole. Elimination mainly by the urine and feces, but basic you understand the half life of this pantoprazole without any extra coating is 1 to 2 hours. If you coated some of the delayed release type of the coatings, so sustained release type of the coatings, we can increase the half life of this pantoprazole, but basic you understand 1 to 2 hours is the half life. Side effects: headache is one, nausea, vomiting, joint pain, diarrhea and dizziness. These are the common side effects of the pantoprazole. Next, how to prevent hyperactivity, sorry, it's not activity, hyperacidity. Hyperacidity. How can you prevent? Say, consume less caffeine, avoid drinking alcohol, maintain food chain time. See, food chain time is very important. If you taken your lunch, okay, at the time 8:30 or 9, continue at that only. Don't miss that, or don't bypass your lunch or breakfast, clear, or any food what you are drinking, no, take in a limited way, take in a correct and accurate time. Then avoid fast food type of the items, like those items which contains the oily nature, fat nature, you have to avoid that one. Consume lukewarm water. Morning you have to take a glass of lukewarm water. Apple vinegar, it is also very important, it contains citrus, so it can suppress the action of the HCl. Black cumin seed, yes. Then don't drink soft drinks like Coke, Pepsi, these all are the carbonated beverages which harms or which provokes for the production of the HCl. Yes dears, these are the very important lecture for the information purpose only of the drug known as the pantoprazole. Okay, so if you like this video, share our channel, subscribe our channel Legend Pharmacy. Thank you.